So the next presenter is Dr. Suchitra Kumari Biswal. She's going to speak Never Belittle the Classic.
Hello everyone, this video is about rediscovering the classic which is fading away. A 43-year-old lady presented with diminution of vision in right eye. Her best corrected visual acuity was 6/12. The anterior segment examination was normal. Fundus examination showed retinal pigment abnormalities at the center of the fovea with a neurosensory detachment. The optical coherence tomography showed presence of neurosensory detachment, flat irregular PEDs, pachyvessels beneath the PED. Cross-sectional OCT angiography showed flow signal within the PED, and the end-phase OCT angiography showed the vascular network. So, we made a diagnosis of pachychoroid neovasculopathy. But we had a query in our mind, is the neovascular network really the cause of subretinal fluid? So we decided to go back to the time-tested classic, that is fundus fluorescein angiography, looking for an answer. Smokestack leak was seen on fundus fluorescein angiography. The smokestack leak confirmed the diagnosis of central serous chorioretinopathy. The final diagnosis was CSC with focal leak with quiescent PNV. We went ahead with focal laser of the leaky point. At 1 month, significant reduction in SRF was seen, and at 2 months, complete resolution was seen. So, our good old FFA worked like a charm. In the era of advanced imaging, the use of FFA is decreasing. In the eyes with coexistent pachychoroid diseases, SRF can be due to CSC or from neovascular network. FFA helps in identifying the source of leak in such conditions.
But it was still a juxtafoveal leak, isn't it?
Yes, sir.
I will be little wary of doing laser. Yeah, too close, but very nicely managed and very nicely thought of. Normally most of us are getting away with invasive angiographies nowadays. Angio OCT, yes, sir, definitely got carried away, but definitely FFA ICG really changes, still changes the game, and thinking point in all these patients. The only thing is that if at all we would have considered focal laser, I would have preferred a yellow laser. So, but definitely green laser I would have avoided. That was my take, but anyway, very nicely managed. Yeah.
Just seeing a neovasculopathy, yes.
Yes.
Seeing good responses.
It also works in CSC sometimes.
It does work. It does work. Yeah, just a juxtafoveal to subfoveal leak actually. Yeah, so that's.
What if we didn't do anything?
Observation is still the treatment, sir. First line of treatment and control the other factors, stress, and other cope.
The duration of disease was about 4 months, sir. So.
In fact, we are treating an ophthalmologist with multifocals here. Fluid comes, fluid goes. The moment you tell him relax for 2-3 months, he comes. Just a juxtafoveal leak, same thing like this. And he has been seen by many ophthalmologists. Everyone says different treatment. But still, this kind of fluids can be observed, sir. It just goes off on its own after. So we have to be patient.
Patients are not patient.
That is what is a criteria.
They want immediate.
The first picture, it looked more like a chronic, persistent.
Absolutely, sir. Absolutely. Absolutely.
But sir, yeah.
No, correct on this, sir. Point well taken.
No, but when we see a PNV, sir, I've noticed that PNVs respond very well to the injection. Patients are also happy with respect to their vision quality.
Chronic CSC. And also lead to CSC. Even anti-VEGF would have.
So old is not always gold. We have to remember.
Sir, but it's
Yeah,
always best
but some
to-
classics, they always will be there.
Yes.
They will be always there.
Yeah,
And
so-
enough, so much advancement may be there.
So the thing is, if you don't want to do an invasive test for every single patient, this is a good indicator to tell us to do it or not to do. Like, everybody first of all doesn't have access
Right.
to either ICJ or to Octa. So it's a little worrying in that way. But anyway, nice.
And
Thank
just
you.
to add on, we have done many patients like this in the past with low flowing PDT. So they respond very well. So
Now
that
that
the
we don't
PDT is
have-
not there,
we
but
are
sooner it's
now-
going to be available again. So that option has to be kept in mind. Thank you.